Do you know that why in left heart failure, patient mainly presents with dyspnea? Do you know why in right heart failure, patient mainly complains of hepatomegaly and splenomegaly? The reason is congestion of these organs. That is congestion of lung in left heart failure and congestion of liver, spleen and other organs in right heart failure. So in this video, we will be discussing hyperemia and congestion. So what is hyperemia and congestion? The definition of both hyperemia and congestion is same. That is increase in volume of blood in any organ. You can see the definition. It is increase in volume of blood within any organ of tissue, or it is known as hyperemia or congestion. Then what is the difference between hyperemia and congestion? So I would like to draw a diagram here to explain you the difference between hyperemia and congestion. Let's see. Can you see? This is the organ. This can be any organ of human body. This can be any tissue of human body. This is the arterial supply to that organ which supplies pure blood to this organ. So this is the flow of the blood. You can see the arrow. This is the venous drainage of this organ which is carrying impure blood away from the organ and giving it to the right side of the heart for purification. You can see the arrow. Now imagine two conditions one by one. Imagine the first condition, that artery got dilated. What will happen if the artery will dilate? If the artery will dilate, this organ will receive more of the pure blood. So increased volume of blood inside the organ, that is pure blood. This is known as hyperemia. Hyperemia is an active process which occurs due to arterial dilatation. So there is more blood supply to the organ. And the organ, since the blood is pure, that is oxygenated, that's why the organ look redder here. That is erythema of the organ takes place in hyperemia. Let's see other condition. So you can see what happens if the vein is obstructed. If the vein of the obstructed is obstructed, the venous drainage is compromised. What will happen? The arterial supply is normal, but the venous drainage of the organ is compromised. It is obstructed. So what will happen? The impure blood, that is the deoxygenated blood, which will accumulate inside the organ. So increase volume of blood here also, but this time the blood is deoxygenated, it is impure. So this is known as congestion. Congestion is the passive process which takes place due to impaired venous drainage of any organ. Here also increase volume of blood, but this time the blood is impure, deoxygenated. That's why the organ look bluish in color, not reddish. And this is known as cyanosis. So you got what is hyperemia, what is congestion. In both of them, there is increased volume of blood in the organ, but hyperemia is due to arterial dilatation. It is the active process. Congestion is due to venous obstruction, venous drainage obstruction, impaired venous drainage, and it is a passive process. In hyperemia, oxygenated pure blood accumulate in the organ. In congestion, impure or deoxygenated blood accumulate in the organ. So in hyperemia, organ looks redder. In congestion, organ looks bluish. So that is the differences between them, hyperemia and congestion. But the common definition is increased volume of blood in the organ, hyperemia and congestion. So you can see the same diagram here also. In this diagram, you can see an artery. This is the artery. Artery is dividing into arteriole and capillaries are giving rise to venules, and ultimately a vein is formed. You can see the vein. Now the same two things will happen, either the artery dilate or the venous, or else the second condition, the venous drainage is impaired. One of the two conditions is taking place, leading to hyperemia and congestion. So you can see, let's start hyperemia. So as I've told you, hyperemia is increased volume of blood because of arterial dilatation. So it is an active process. For the dilatation of the artery, ATP is required. It is an active process. And the affected organ contains oxygenated pure blood. That's why the affected organ is reddish, red in color, and it is known as erythema of the organ. That is hyperemia. What are the examples? There are few examples. That is inflammation. In acute inflammation, whenever any organ of human body have acute inflammation, the organ get redder. That is erythema of the organ takes place because of vasodilatation, the arterial dilatation of that organ. The second is blushing. At the time of the emotional changes or during some tension, the cutaneous blood vessel of the face, they undergo vasodilatation. The arteries of the face undergo vasodilatation. It is known as blushing. During exercise, the person look reddish because of the dilatation of the cutaneous arterioles and arteries. In high-grade fever, the person becomes reddish because of, again, the cutaneous arteriolar vasodilation. These are the examples of hyperemia. Let me come on congestion. What is congestion? As I have already told you that congestion is also increase in volume of the blood, but it is due to impaired venous drainage. The venous drainage is obstructed. So this time, this is a passive process. For obstruction or impairment of the venous drainage, no ATP is required. That's why it is a passive process. And here, the deoxygenated impure blood is accumulated inside the organ. That's why organ is bluish in color, and this is known as cyanosis. This is known as cyanosis. So you can understand now, hyperemia is due to artery dilatation and congestion is due to venous obstruction. One is active, one is passive. So in this diagram, you can see the color change. You can see in normal, during normal, half of the organ is red and half is blue. But in hyperemia, the organ look reddish. The reddish color is more. You can appreciate more reddish in this diagram because of erythema, because of oxygenated pure blood accumulation. And in congestion, you can see more of bluish color because of deoxygenated or impure blood. So you can understand the color change in the diagram, that is reddish erythema in hyperemia and bluish cyanotic in congestion. You can understand the differences between hyperemia and congestion. It is in front of you. You can see hyperemia is an active process, congestion is a passive process. You can see hyperemia is due to arteriolar dilatation and congestion is due to impaired venous outflow. You can see in hyperemia, the organ convert red or pink because of the oxygenated blood accumulating inside the organ. And in congestion, the organ is bluish or cyanotic because of impure deoxygenated blood accumulating inside the organ. Now, in MBBS syllabus in your exam, hyperemia, the definition and examples are sufficient. But congestion, you have to study a little bit detail. So let me tell you the details of the congestion now. Congestion are of two types, acute and chronic. We have to study the chronic congestion. The chronic congestion is known as CVC, that is chronic venous congestion, or it is also known as chronic passive congestion, CPC. CVC and CPC are the synonyms. That is chronic venous congestion, and since we know venous congestion is passive in nature, it is not active. That's why it is also known as chronic passive congestion, CVC and CPC. So, you have to understand two things here, left heart failure and right heart failure. Let me show you a diagram of the heart. In front of you, you can see a diagram of the heart. In this diagram, you can appreciate one by one, we will take two situations. Let's take the first situation. What will happen if left heart failure occurs? What do you mean by left heart failure? The left ventricle is not pumping. The left ventricle is not ejecting the blood. It is not doing proper systole, vigorously systole. So what will happen? Normally, when left ventricle do the systole, the blood is ejected in the aorta and blood goes in all the organs, the pure blood via aorta. But here, the left ventricle is not doing the systole. So what is happening? Blood is not going ahead in the aorta. So where the blood is going? Backflow. So blood is going backward, not forward. The blood is going backward. From left ventricle, the blood is going to left auricle. From left auricle, the blood is going in pulmonary vein. And from pulmonary vein, more and more blood is going in the pulmonary capillaries in the lung. The pulmonary capillaries in the lung and the pulmonary vein is having more blood. This is known as CVC, chronic venous congestion of the lung. You got my point? Here venous drainage is obstructed. You can see here pulmonary vein is having more blood. Right? It is not carrying blood ahead. Because of the backflow, there is more blood in the pulmonary vein. It is a vein. It is not an artery. That's why it is chronic venous congestion of the lung. So the summary is that, the point is that, the bottom line is that in left heart failure, CVC of lung take place. The mechanism is in front of you. Let's take another situation. What will happen if right heart failure takes place? Imagine the other situation. This is the right ventricle. It is not doing systole. It is not pumping properly. It is not ejecting the blood ahead. So when right ventricle is not doing the systole, normally when right ventricle does the systole, the blood is ejected. The blood will go in the pulmonary artery and it will go in the lung for purification. But here the right ventricle is not doing the systole. So what will happen? Blood is not going ahead. So where the blood will go? Blood will go backward. So here from right ventricle, it will go to right auricle. From right auricle, it will go to SVC, IVC, superior inferior vena cava. And from here, it will go to the veins of all organs. Again, you can see the veins of all organs of human body. But here I will discuss only two important organs, the liver and spleen. Liver and spleen. So CVC of liver and spleen takes place in right heart failure. So what is the summary? The summary is that in left heart failure, only one organ CVC takes place, that is lung. CVC lungs takes place. In right heart failure, CVC of all systemic organs takes place, but I will discuss only two here, that is liver and spleen. So in our syllabus, there are 3 CVCs. You can see the same information given in this flowchart also. You can see in left heart failure, there is CVC lung. But in right heart failure, it is CVC of all organs of human body except lung. But here, I will be discussing only 2 CVCs which are important in MBBS syllabus for the exams, the university exams. It is CVC liver and CVC spleen. So we have to discuss 3 CVCs. CVC lung, liver, spleen. CVC lung takes place in left heart failure. CVC liver and spleen takes place in right heart failure. I guess everyone understood this. Let me start the 3 CVCs one by one. In each of the CVC, chronic venous congestion, I will teach you one by one in this sequence only. We have to study the gross and the microscopy of that particular organ. Let me start with CVC lung. So what is the gross here? In the gross, you have to learn one word. The lung look brown induration. There is brown induration in the lung. The reason for the brown induration is hemosiderin deposition inside the lung. Hemosiderin is a pigment which is brown in color, which is providing brown induration to the lung. When I will teach you microscopy, you will understand why hemosiderin is coming in the lung, from where hemosiderin is coming in the lung. But here the brown induration is due to hemosiderin. So in gross, you have to learn one word. The lung is heavy, firm in consistency, and it is brown in color. Brown induration of the lung takes place in CVC lung. And CVC lung takes place in left heart failure. We have already understood this. That is CVC lung, right? You can see in left heart failure, this is the left heart failure. Blood is not going ahead in the aorta, it is going backward. From backward, it is going to left auricle, pulmonary vein, and it is coming in the pulmonary capillaries. That leads to CVC lung. Now see the microscopy. In the microscopy, I will draw the lung. I will draw the diagram of a lung, the microscopic appearance, the histopathologic appearance of the lung in CVC lung. So you can see here, this is the gross diagram. You can appreciate the brown induration. Please appreciate the brown induration here. The brown induration is due to hemosiderin pigment deposition in the lung. That is gross. Coming on microscopy. So in microscopy, you have to understand when left heart failure takes place because of the backflow of the blood, there is more blood in the pulmonary capillaries. So this is the diagram. In this diagram, what you can see what are these things I am marking with the pen. What are these things? These are alveoli. Normally, the alveoli contains the air for exchange of gases. So oxygen from the alveoli goes to the blood and carbon dioxide from the blood comes to the alveoli. So exchange of gases takes place in the alveoli, in the alveolar wall. You can see the multiple alveoli are there. I am marking here. All of them are alveoli, right? And in between the alveoli, in the alveolar septa, these all are pulmonary capillaries. So I'm drawing the pulmonary capillaries with red color. You can see the illuminated structures. All of them are multiple pulmonary capillaries. Now in this diagram, you can see because of left heart failure, the blood is going backward in the pulmonary vein and it is accumulating in the pulmonary capillary. So where is the pulmonary capillary? Now correlate with this diagram with this diagram. Where are the pulmonary capillaries in this diagram? You can correspond, you can correlate. So the capillaries, the pulmonary capillaries, they will get dilated. So I will teach you the 4 findings in this diagram that you have to write in your exam. The first is the dilatation of the pulmonary capillaries. You can appreciate the dilatation of all pulmonary capillaries here. Number 1. Because of the dilatation of the pulmonary capillary, there is more blood inside these capillary, more hydrostatic pressure, more blood, more water, more hydrostatic pressure inside the pulmonary capillary. So the fluid will come out and it will lead to edema. You have to appreciate the background edema here. Let me show you where is the background edema. Please appreciate the background pink color here. I'm drawing. See the background of the capillaries. The background of the capillary have a light pink color. That is edema. The edema first takes place in the interstitial space. This is known as interstitial edema. When the edema progresses, the edema fluid, the fluid will enter inside the alveolar spaces also. And you can appreciate the pink color in this alveoli, the background pink color. This is known as alveolar edema. So point by point, if we say what things are happening. So the first thing, pulmonary capillary dilatation. Let me write pulmonary dilatation. The capillaries are dilated, because of which hydrostatic pressure increases. There is more blood inside the capillary, more water. More blood means more water. More water means increased hydrostatic pressure. So the fluid will come out. So the first edema is interstitial edema followed by alveolar edema. So 2 edema take place one by one. First, the fluid get collected in the background, that is in the interstitial space, which is known as interstitial edema. In interstitial edema, the gaseous exchange is not affected because alveoli till now they are empty. They contain air and gaseous exchange is normal. So patient don't have dyspnea. But whenever the edema fluid crosses the alveolar space and filled in the alveolar space, so air is replaced by the edema fluid now and patient presents with dyspnea, right? The last and the fourth finding, these are the three findings. Now these pulmonary capillaries which are dilated, they will rupture. They will just rupture. So when they will rupture, RBC come out. RBC contain hemoglobin, RBC will also rupture and hemoglobin come out. The hemoglobin get converted into hemosiderin. So what is happening? The capillaries are rupturing, RBCs are coming out, RBCs are rupturing, hemoglobin is coming out and hemoglobin getting converted to hemosiderin. Now, the lung have macrophages in that. These macrophages will engulf the hemosiderin. Can you see the cells? Let me mark the cells for you. Can you see these cells? Please appreciate all these cells. These cells are the macrophages and see the cytoplasm of these cells. It contains hemosiderin. So these are hemosiderin containing macrophages which are known as heart failure cells. So the fourth finding here is the heart failure cells are formed. Now please appreciate heart failure cells are misnomer. Looking at the term heart failure cell, you may feel like the cells are present in the heart. No, the cells are not present in the heart. The cells are present in the lung. Then why they are known as heart failure cell? These are known as heart failure cells because they are present in lung when left heart failure takes place. Only in that condition they are present in lung. That's why they are known as heart failure cell. So basically heart failure cells are the hemosiderin laden macrophages. So in this image I can see four findings. What are the four findings? I can see pulmonary dilatation. Let me mark the pulmonary dilatation. Pulmonary capillaries are dilated, number one. So the fluid comes out from the capillary. The fluid first deposited in the interstitial space in the background, giving rise to interstitial edema. After interstitial edema, the same fluid enters inside the alveolar spaces, causing alveolar edema. Now the capillary will rupture, RBC will rupture, hemoglobin come out, hemoglobin convert into hemosiderin, and that hemosiderin is engulfed by a macrophage. Such a macrophage which has engulfed a hemosiderin, it is known as hemosiderin laden macrophage, that is heart failure cell. That is the hallmark feature, pathognomonic feature of CVC lung. You can appreciate in the diagram, and this is how you have to write in your exam the 4 points in CVC lung. So alveolar septa are widened, there is interstitial edema, followed by alveolar edema, there are heart failure cells. These heart failure cells which are hemosiderin laden macrophages, these are giving brown induration to the lung on gross. On gross, I told you that lung become brown in color. The reason is hemosiderin laden macrophages. You can see here. So this is how you have to draw the diagram and describe the microscopic features. So that is all about the CVC lung. Now let's start so heart failure cells are the misnomer. They are not present in heart. They are present in lung, not in heart. And these are hemosiderin laden macrophages. We have understood it. So that is the diagram we have understood. Let's start the next CVC liver. Now CVC lung takes place in left heart failure, but the remaining all CVCs, that is CVC liver, CVC spleen, it takes place in right heart failure. So let me start CVC liver now. So in CVC liver, in the gross, you have to understand a term that is known as nutmeg appearance. I guess you know what is a nutmeg. So liver is looking like nutmeg. This is nutmeg. You can see, you may have seen the nutmeg in your kitchens, right? So this is nutmeg. Nutmeg. You may know what is nutmeg. Why liver is known as nutmeg appearance? Why? What is the similarity between the liver and the nutmeg? In the nutmeg, you can appreciate alternate red and yellow areas. Red and yellow areas. Alternate red and yellow areas are there in the entire nutmeg. Liver also looks like nutmeg. Compare the nutmeg with the liver. You can see here the nutmeg. Can you see here the nutmeg? Appreciate the liver. So liver and nutmeg are both having alternate red, yellow, red, yellow, red, yellow areas. So that is the meaning of the nutmeg here. So in the gross, you have to say liver have due to red and yellow mottled appearance. And that is giving the appearance of the nutmeg. That is alternate red, yellow mottled appearance in the liver. So that is the gross term nutmeg. Now let me describe in microscopy why the liver have alternate red and alternate yellow zones. So let me describe the microscopy. In the microscopy, you must appreciate that it is taking place in right heart failure. So in right heart failure, blood is not going ahead. The blood is going where? It is going backward. From right ventricle, it is going to right auricle. From right auricle, it is going to SVC, IVC. And from SVC, IVC, it is getting to the organ. Here, my organ is liver. That's why it is going to the vein of the liver. The vein of the liver is hepatic vein or central vein. So here, there is dilatation of hepatic vein or central vein. So you can see the slide. In this diagram, you can appreciate this is portal triad. At one diagonal, this is the portal triad. Portal triad contains three things. That is hepatic artery. This is hepatic artery. This is portal vein. And this is bile duct. This is bile duct. These three things together known as portal triad. But the portal triad is absolutely normal. There is no problem in hepatic artery, portal vein and bile duct. Where is the problem? The problem is in the central vein or hepatic vein. At other diagonal, you can see this is the central vein or hepatic vein. This is hepatic vein, also known as central vein. Because in right heart failure, you can see the backflow. Due to the backflow of the blood is going in SVC, IVC and the blood is going in the vein of the organ. The vein of the organ, here my organ is liver. So vein of the organ is hepatic vein. So there is dilatation of the hepatic vein. So if you can appreciate in this diagram, this hepatic vein, it is dilated. And after dilated, it is ruptured. And if you can appreciate, the blood is coming out. In this diagram, please appreciate the blood coming out of the hepatic vein or central vein. This blood is impure blood. So the hepatocytes surrounding the hepatic vein or central vein, they undergo hemorrhagic necrosis. That is central hemorrhagic necrosis. The central hepatocytes, all the hepatocytes which are surrounding hepatic vein or central vein, they undergo hemorrhagic necrosis. They look red in color. This will give the red color. And the hepatocyte which are near portal triad, can you appreciate all these hepatocytes? All these hepatocytes which are near portal triad, these are the peripheral hepatocytes. They undergo fatty change. Please appreciate the adipocytes inside them, right? These are the fatty changes, which is this fatty change is giving yellow color. So this is giving red color. This is giving yellow color, and that is red, yellow, red, yellow, red, yellow. That is giving the nutmeg appearance, the alternate red, yellow, mottled appearance. That is red, yellow. So you got my point. So what is CVC liver? In CVC liver, you have to explain the reason for the red color, the reason for the yellow color, and alternate red, yellow is giving the mottled appearance, that is nutmeg appearance. So what is the reason for red color? The central vein is dilated. It got ruptured. So the hepatocytes, that is centrilobular hepatocytes, the hepatocytes surrounding central vein, they undergo hemorrhagic necrosis. It gives red color. So this is the reason for the red color. Now the peripheral zone hepatocytes, they undergo fatty change, and because of the fatty change, they look yellow in color. So this alternate red, yellow will give nutmeg appearance to the liver. So you must be able to describe it, and not only describe it, you must be able to draw it in the exam. In the exam, you must be able to draw the central vein and the hepatocytes surrounding it. You may be able to show the red color in them because of hemorrhagic necrosis, and you may be able to draw the portal triad, the hepatocytes surrounding them, that is peripheral hepatocytes undergoing fatty change, which is giving yellow color. So alternate red, yellow will give the nutmeg appearance, that is mottled appearance. Now I would like to draw the lobular model for you. You know, liver have a lobular model. What do you mean by lobular model? It is a hexagonal lobule. Inside the liver, multiple hexagonal lobules are present. Can you appreciate the multiple hexagonal lobules? I'm drawing these lobules to explain you the nutmeg appearance. So these are the hexagonal lobules. You can appreciate the entire liver is like this. So multiple hexagonal lobules are there. At the center of each lobule, there is central vein or hepatic vein. That's why it is known as central vein. The hepatic vein is present at the center of the lobule. That's why known as central vein. It is also known as central vein. And at the periphery of each lobule, we are having portal triad. So at each, there are 6 peripheries. We are having 6 portal triads. I'm not drawing everywhere, but you can imagine we are having portal triads at the periphery. In each portal triad, we are having one hepatic artery. So I'm drawing one hepatic artery in each of them. There is one portal vein. So I'm drawing one portal vein in each of them. And there is one bile duct. So I'm drawing one bile duct in each of them. So you can appreciate the same portal triads everywhere in all hexagonal lobules. Now there are row of hepatocytes connecting them. So what I have told you, the hepatocytes which are near central vein, the centrilobular hepatocytes, they undergo hemorrhagic necrosis. That's why they will turn red in color because of the hemorrhagic necrosis. So let me draw red color here. So this is the red color everywhere. This is the red color you can appreciate. Now the peripheral hepatocytes, the peripheral one, which are near portal triad, they will undergo fatty change, because of which they look yellow in color. So this is the yellow color. You can see alternate red yellow. This is typical nutmeg appearance, which I am talking about. So this appearance, which is shown here, the alternate red yellow, this is known as nutmeg appearance. You should know the reason for the red. You should know the reason for the yellow. That is about CVC liver. CVC liver. Now, let me come on the CVC spleen. The last thing, CVC spleen, the third CVC. So, CVC spleen also takes place in right heart failure. In CVC spleen, in gross, you have to learn only one word. The surface is grayish tan. You can see the diagram of a spleen. This is CVC spleen. It is looking grayish tan in color. Grayish tan in color. Now, before understanding the microscopy of CVC spleen, you must understand the normal histology of spleen. In this diagram, you can see a normal spleen. The normal spleen have a capsule. Let me show you. This is a capsule. From the capsule, these are the trabeculi. Trabeculi arises from the capsule. Now, inside the spleen, we have two things. Number one, red pulp, and number two, white pulp. What is red and white pulp? What is white pulp? What is white pulp inside the spleen? So, white pulp is the follicles formed by the lymphocytes. Can you see the lymphocytes are arranged in the form of the multiple follicles? So, these lymphocyte follicles is white pulp. And in between them, we have blood capillaries, or we have special capillaries which are known as sinusoids. So this is red pulp. This is red pulp. Now you tell me, in right heart failure, what is happening? In right heart failure, the blood is going backward. Now, due to the backward blood, it is going in right auricle, SVC, IVC, and it is going in the vein of the organ. The vein of the organ is leading to the capillary of the organ. So which pulp will enlarge in right heart failure? In the spleen. In the spleen, we are having two pulp, white pulp and red pulp. White pulp is the lymphocyte and red pulp is the capillaries, that is sinusoids. Because of right heart failure, because of the backflow of the blood, the red pulp will enlarge. So in CVC spleen, the red pulp will enlarge, not the white pulp. See, this is the diagram of CVC spleen. I guess now you can understand it. This is the capsule. This is the trabeculi coming out of the capsule. You can understand that. You can see this is all white pulp. This is all white pulp. White pulp is the follicles formed by the lymphocytes. These all follicles formed by the lymphocytes, this is white pulp, but this is absolutely normal. In CVC spleen, it is normal. White pulp means there is no change. But see the red pulp. Can you appreciate here the sinusoids, the capillaries, the sinusoids, the capillaries, they increase in number drastically and they are dilated. They are dilated. So the red pulp is enlarged. So the point is, red pulp is enlarged and sinusoids are converted into capillaries. It is known as capillarization of the sinusoids. Now, the red pulp is enlarged, so the capillaries, the sinusoids, the capillaries, they will rupture. They will rupture, and because of rupture, the blood is coming out. And when the blood is coming out, RBC also get rupture. Now, RBC may say hemoglobin is coming out, and that hemoglobin get converted to hemosiderin. The hemosiderin along with fibrosis is known as gamma-Gandy body. Hemoglobin along with fibrosis is known as gamma-Gandy body. So that is gamma-Gandy body. You must appreciate it. You can see here in the diagram, this is hemosiderin along with fibrosis. When the capillaries are rupturing, RBC coming out, RBC rupturing, hemoglobin come out, hemoglobin get converted into hemosiderin, hemosiderin deposited over fibrous tissue leading to gamma-Gandy bodies. So that is CVC spleen. In the CVC spleen, we found gamma-Gandy bodies. So basically, what are gamma-Gandy bodies? Gamma-Gandy bodies is the hemorrhage along with fibrous tissue along with hemosiderin pigment. That is known as gamma-Gandy body. So that is CVC spleen. So we have learned three things: CVC lung, CVC liver, CVC spleen. In each of them, we learn one main point. In CVC lung, we learned heart failure cells, which are seen in the lung because of the left heart failure. In CVC liver, we learned nutmeg liver. And in CVC spleen, we learned gamma-Gandy bodies. We have learned gamma-Gandy bodies. So these are the three findings we have learned: CVC lung, CVC liver, CVC spleen. That's it. So what is the summary? What we have learned today? We have learned hyperemia and congestion. So what is the difference between hyperemia and congestion? Hyperemia and congestion both are increased volume of blood in an organ. But in hyperemia, it is due to arterial dilatation. So pure oxygenated blood is accumulated. In congestion, the impure blood, it is due to venous drainage. So impure deoxygenated blood get accumulated. So the congestion is important. It is chronic venous congestion, CVC congestion of three organs we have learned. CVC lung, the diagram is in front of you. You can appreciate the pulmonary capillaries are dilated in this diagram. And you can appreciate the edema, first interstitial edema, the background edema, and then alveolar edema, which is leading to dyspnea. So the two types of edema you can appreciate here. And after that, you can appreciate the blood vessels are dilated, they got ruptured, hemoglobin coming out, converting to hemosiderin, macrophages engulf the hemosiderin, leading to heart failure cells. So heart failure cells are important in CVC lung. The next is CVC liver. In CVC liver, we understood nutmeg appearance. In nutmeg appearance, two things are there: the red areas, the yellow areas, alternate mottled appearance, alternate red and yellow. The red area is due to central hemorrhagic necrosis, and the yellow area is due to fatty change. So alternate red and yellow is leading to the nutmeg appearance. That is nutmeg appearance you can appreciate in the CVC liver. In the CVC spleen, we have appreciated the red pulp is dilated, white pulp is not dilated, white pulp is normal, but the red pulp is dilated, it is enlarged. Now the sinusoids will get rupture, again hemoglobin convert into hemosiderin, and hemosiderin along with fibrosis is known as gamma antibodies. So that's all about CVC.